We promote a survey in order to understand what does a good or a bad clinical practice means for HD families. Why we did this? Because we have been collecting a lot of complaints from patients during the years, but not in a scientific way. So what we wanted to do is to give a methodology to measure those complaints in order to understand what can be done to improve the clinical practice for HD patients. The primary findings are related basically to what is missing most according to patients' experience. So the primary findings can be turned into 5 recommendations that patients give to HD professionals. First of all, we find out that the genetic and psychological counseling for HD at-risk patients is not always provided, whilst it should be a common practice. Second, time is not enough. So usually practitioners don't give enough time to answer patients' questions and to explain them what's going on about their health and also about research. Then another important point is about the family. So patients need to have not only an individual medical plan, but they need a family plan from the doctors, because HD is a disease that affects the whole family. So they need to be each single component member of the family needs to be prepared to what is next in the future. And finally, network. They feel more comfortable and they feel more secure when they are followed by a doctor who is not isolated in the world, but who is connected with other doctors and with other researchers, possibly internationally, globally, not only in their country. I think that there are 2 kinds of main implications for the management of HD. From one side, the implications are on attitude side. So doctors should be more sensitive toward patients, should dedicate them more time and talk to them in a more comprehensive way. From the other side, there is a management change that can be expected in terms of how many follow-up visits they are expected to plan for each patient, and about the connection with others, so to be part of a network. So it's more about management. Also, the family plan requires a different way to manage the disease and to plan the patients, the family management from the healthcare professional.